I got interested in breast cancer research when I was asked to look at the amount of radiation that was being used in making mammograms in the late 1970s. And I was rather horrified by how inefficient the technology was at the time.
What's exciting about the research I do is that it's very linked to the breast screening program. Breast cancer is still the #1 cancer for women. Although we know there are risk factors for breast cancer and we can try to prevent breast cancer, with breast screening their cancers are found earlier. It gives them more treatment options. It gives them a better chance at survival.
We've been working on the development and clinical evaluation of something called digital breast tomosynthesis. So what we've done is we've developed a three-dimensional kind of mammography where it's much easier to see a cancer if it's present, because we're really looking through the different levels of tissue in the breast.
The way organized screening was implemented in Canada was there had been several randomized control trials that compared women who had screening, mostly mammography, compared to women who did not. And these trials, when you looked at the evidence, it showed that there could be a reduction in mortality.
We have such good evidence that finding breast cancer earlier saves lives, and it also makes the treatment of breast cancer easier on the women involved.
I was interested in determining whether one type of mammography technology, which is digital mammography, how it compared to screen film mammography, which was what we were previously using. A mammography can find about 5 cancers for every 1,000 women screened. The computed radiography was finding 4, so that's 1 less cancer for every 1,000 women. So that was a very significant finding. Because of this study, the Ministry of Health and Long-Term Care actually replaced all of the computed radiography machines in Ontario with digital direct radiography machines.
The technology is here now. It's available, but what we need to do now is to demonstrate that it actually does what its promise was, and that is allowing us to find breast cancers earlier, to avoid missing some of the breast cancers that are currently missed with today's mammography, and also to have fewer false alarms. And what we're about to do is a large clinical trial which has really been funded. It's been initiated by CBCF. We're doing the lead-in part of that trial here in Canada to show the benefits of breast tomosynthesis.
I don't think we can stop. We're close to finding out more about this and being able to define it better for women. And I feel that women should be more aware of their options and choices about their health care.